In this video, I'm going to show you how to relieve carpal tunnel syndrome in seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over a step-by-step guide that can quickly relieve carpal tunnel syndrome, even within seconds. If you're unfamiliar with carpal tunnel syndrome, it's an overuse injury of the wrist that causes irritation and inflammation of soft tissues around the carpal tunnel, leading to compression of the median nerve. It's usually brought about from repetitive flexion and extension of the wrist, so think activities like typing. But when the median nerve gets compressed, it can cause a lot of issues, including numbness, tingling, and pain into the palm, towards the thumb, towards the index and middle fingers. To make getting relief easy, I'm going to break the video up into 3 separate parts that are going to focus on lengthening and, more importantly, strengthening these soft tissues. While these parts are different, they are meant to go together. So if you want the best results, use all 3 parts. With that being said, let's get started. So let's begin by releasing soft tissue tightness and inflammation that may be building around the carpal tunnel. This is known as gua sha or muscle scraping, and it can give both quick and long-lasting relief. We just need a couple things. The first being a form of lubrication. Any massage oil or lotion designed to be put on the skin will work. Next, we need a large metal spoon. You want one with a little bit more thickness. Start off by taking your lubrication and putting it all over your hand, wrist, and forearm on all sides. We're going to target everything. Next, let's find the area of the carpal tunnel. Make a fist and then bring your fist towards you. You're going to notice a ridge forms on your wrist. This is where the median nerve travels, and the area of the carpal tunnel is pretty much right in this ridge right here at the junction of the wrist going into the hand. So we really want to target this area as much as possible. So let's grab our spoon, and it doesn't matter what part you use. You can use the rounded portion, the handle, the tip. Experiment with it. Anything works better for you, go with it. I like to start on my palm right here on the inner part, right on the pinky side. You're going to take your spoon and angle it roughly at 30 to 45 degrees and apply enough pressure in where you're going to get a comfortable self-massage but not causing discomfort. And just like the name implies, we're going to scrape the soft tissue just like this. Work top down and do this for about 5 to 10 repetitions over one spot, and then just move over and repeat, doing this from the inner part all the way towards the thumb. From there, work your way down into the wrist and repeat. When you do this, you're probably going to notice that red pockets start to form over the skin. I don't know if you can see it over the video right here. That's a good thing. That's blood flow coming into the area, which helps promote healing. You also may find that some spots just feel really tight, gritty, almost kind of like sandpaper. That's generally a spot of an adhesion, and you really want to target that as much as possible. So throw some more repetitions in until you break that up. But I do this whole process over the palm right here, over the thumb, into the wrist, and then into the forearm. Any spot needs more tension, at that point spend some more time and throw some more repetitions in. Afterwards, you can then target different areas. You can do this in the fingers, over the whole palm right here. You can do this on the side of the wrist. You can do it also on the back side of the hand, and I would recommend really focusing on the forearms as much as possible. You can take this one to the next level too by putting the wrist through different motions to engage muscles and really activate some tendons that might be associated with carpal tunnel syndrome. So make a fist like this, and then what you're going to do is flex your wrist, bringing it back like this, really causing that ridge. Start to work around the ridge as much as possible and also into the palm. You can also take your wrist into extension, so bringing it back like this and then repeating, going on this side, flipping it over towards the side, and then also on the forearm right here on the back side of your hand. You can turn the wrist in and you can also turn it out. So go through all of those motions. If you're able to identify any spot that needs it just a little bit more, at that point, throw more repetitions in. In this part, we're going to focus on lengthening the median nerve pathway and also the soft tissues around the carpal tunnel. This first one is known as a median nerve glide. It's a 3-part progression exercise that you can do throughout the day anytime that you need quick relief. You just need a smooth wall or a door for this one. It's pretty straightforward. You're going to straighten your arm and press your fingers into the door, just like this. From there, you're going to slowly lower your hand and press your palm towards the door. The more that you press your palm towards the door, the more that you're going to feel a deep stretch forming on the bottom of the wrist right here, working its way to the carpal tunnel. Only go to the point where it's a comfortable, deep stretch. Don't go to the point where it's going to cause more discomfort. Hold this one for 2 to 3 seconds. You're going to release it, and then you're going to repeat this one 15 times. With each repetition, challenge yourself to press your palm closer towards the door. Once you're able to do this one for 15 repetitions where your hand is flush against the door and it's not causing any more discomfort, then progress onto the second step to get a more intense glide. So with this one, imagine that our fingers are pointing up towards 12 o'clock. What we want to do is rotate our fingers downward so they're pointing at 6 o'clock, and then we're going to repeat this. This is a much deeper stretch. I pretty much feel it all across my wrist right here. Again, a 2 to 3 second hold, you're going to relax, and then repeat this one 15 times. If you have no issues with that, we can then progress into the third step. So this one right here, we're going to go back to our 6 o'clock spot, but now we're going to move our head to really intensify that glide. So you're going to take your head and lean it towards the door, taking your ear towards your shoulder. And then you're going to hold this for about 2 to 3 seconds. You're going to release it, and then you're going to go towards the opposite way. So taking your head away from the door, again, 2 to 3 second hold, and then relax. You want to do this one again for 15 repetitions. And with each repetition, try to build into it just a little bit more. So after we're done with our median nerve glide, we're then going to combine it with a tendon glide to work more muscles and tendons associated with carpal tunnel syndrome. So take the back side of your hand and put it flat against a table or a flat surface. We're going to take the tips of our fingers, minus our thumb right here, and just curl and hook them forward to the top part of the palm. You want to hold this position right here for roughly 2 to 3 seconds. You're then going to relax. And then what you're going to do is take your fingers all the way down towards the wrist as much as you can. You should really start to feel a lot start to fire around the wrist and also into the hand and fingers. 2 to 3 second hold, you're going to release. The last movement that we're going to do is then hook forward and then take our thumb and really kind of squeeze into it and make a nice fist. 2 to 3 second hold, and then you're going to relax. But you're going to repeat this process nice and slowly for about 15 complete repetitions. And with each repetition, try to build into it just a little bit more. If you're looking to get long-lasting relief, possibly even prevent carpal tunnel syndrome, your main focus needs to be on strengthening the muscles and the tendons associated with it. Here's a really easy daily exercise that requires just a simple weight like a water bottle. So what I'm going to do is position my arm at the edge of a flat surface where my palm is going to be facing down. Let's grab onto a water bottle. If you want to make this one more challenging, you can use something like a dumbbell, but the movement pretty easy. You want to position your wrist and hand off that edge. That way our wrist is going to do all of the movement. Take your other hand and clamp down on your forearm to make sure that it's a stable anchor point. But just lift the weight upward as much as you can. This is known as wrist extension. The more that you go up, the more that you're going to feel a lot of muscles in the forearm towards the wrist start to fire. I like to hold this one for about 3 seconds, release it, and then repeat this one 10 to 15 times. From there, we're going to switch positions of our hands so the palm is going to be facing upward towards the ceiling, and then we're going to repeat lifting that weight upward. This is known as wrist flexion. It'll hit the muscles just a little bit differently. Again, 10 to 15 repetitions, each repetition a 3-second hold. Next, we're going to focus on what is known as ulnar and radial deviation, kind of an inward and then outward motion of the wrist. I like to start with my thumb upward towards the ceiling, kind of like a hitchhiker sign. Movement pretty easy. Again, we're just going to lift that weight up as much as we can until we can't go any further. Hold that for about 3 seconds. But with this one now, we're going to fight that weight going down. So slowly take the weight downward like this. And you're going to notice, again, it hits the muscles just a little bit differently. So when you can't go any further, you're going to hold this one for 3 seconds, come back up, and then just repeat this one 10 to 15 times in both directions. The last movements that we're going to focus on are known as supination and pronation. It's kind of like a rotational movement of the hand and the wrist. So we're going to focus on turning our thumb downward like this, really trying to turn our hand inward as much as we can until we feel those muscles fire. And then we're going to do the opposite, turning our thumb outward like this so our palm is really facing upward towards the ceiling. So with the weight, we're just going to mimic that movement. For this one, I like to lift my arm off of the table and have my elbow straight and then do that movement. So going down as much as I can until I really feel those muscles fire. 3-second hold, you're going to come back up, and then you're just going to turn outward like this, repeating 10 to 15 times in both directions. And again, if you want to take this one to the next level, use a heavier weight like a dumbbell. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.